Albert Einstein once said, "In the middle of every difficulty lies opportunity." On this note, I welcome you once again to another episode of Healthy Living on Hope TV with me, your host, Bibi. Thank you for making time out of your busy schedule to watch this program. And as we always bring good and educative topics, today we are here again, bringing you another educative topic to discuss and educate you as well. Before we start, we have a professional here who is going to lead us and explain well our topic for discussion today. But before we start, we'll go for this quick break. When we come back, we begin with our discussion. Don't go anywhere. We shall be right back.
Matthew, say Mark, say Luke.
Look at Matthew.
Matthew, say everybody.
I have a school father who smokes weed. Is it right to still hang out with him or stay away from him?
I'll report him, but let me tell you the reason why I'll report him. Because this one, if he gets into trouble, because I was working with him, I'll also be in trouble.
Isn't that selfish?
I don't care.
Hey.
Like, if I'll also not be in trouble, like me, I'll not mind you.
Oh, so what's your rationale not for reporting them? Why won't you report them?
Everyone deserves a second chance.
Saw this picture that a mother posted on top of her fridge. You are not hungry, you are bored.
So you eat out of boredom?
A little. Okay, wait, let me be truthful. A lot.
I don't think having a boyfriend is a bad thing.
Okay.
It's just like, let me say, Ghanaian mentality.
Hey.
Because when you say boyfriend, then something else pops up.
And you're welcome to Teens Connect, the platform for teenagers where we can express freely our thoughts and opinions on various subjects that disturb us, subjects that worry us, and subjects that cause us to think. On this platform, we say anything and everything as long as it's bothering you, and we try and find solutions for ourselves.
Hello and welcome back from the break. This is Healthy Living on Hope TV with me, your host, Bibi. Today we are discussing a very important topic, which is low back pain. Low back pain. I know that these days a lot of us suffer from low back pain because of our posture. And so it is important that we discuss it today so that we know ways and how we can control it and prevent it from affecting our daily lives. As I said earlier, I have a professional here. He's a physiotherapist at the Police Hospital, and in the person of Mr. Michael Bakwaya. Mr. Bakwaya, welcome to the show.
Thank you.
I hope you are doing well.
Yeah.
It's been a while.
Sure.
I hope everything is fine.
By grace.
All right. So before we start, I know you are the clinical side. You take care of a lot of patients, but most importantly, because of this pandemic that is with us, I know that there's a lot of pressure at the clinical side. So how is it like for you?
Yeah, the pressure is everywhere. It's all about we adhering to the protocols that has been laid down for everyone to follow.
Yeah.
During when the virus was on its peak, we all had patients reducing in the hospital, but since the lockdown has been lifted, they are coming back.
Everybody's coming.
Yes. So we just have to protect ourselves as much as possible.
Right, we just have to protect ourselves. I agree with you. But today, our topic for discussion is low back pain, and I know that that is your field. You treat a lot of cases of low back pain. Also, before we touch on low back pain in detail, I know that it is associated with one's posture.
Sure.
And so I would want to ask, if we say posture, what at all does it entail? Or what is it about?
Okay, posture in simple terms is how the body is aligned during muscular activity in terms of walking, running, and how it is again aligned when you are static.
Okay.
or not doing anything. Yes. So basically that is it. Your posture is how your body
Is aligned.
is aligned when you are moving or when you are not moving. Yes.
Okay. When you are moving or not moving. So from what you've explained, it means we have types of posture, if I'm right to say
Exactly,
that.
yes.
Okay, and what are those?
So we have the dynamic
Okay.
and then the static.
Okay.
So from the definition, you realize that the movement, the running, the muscular activity has to do with the dynamic posture. And then the static, when you are seated or standing and not doing anything, would have to deal with the static posture.
Oh,
You get it?
okay.
So that is it.
Okay, okay. Okay, now to our topic for discussion. I know that this posture will appear again in our discussion,
Sure.
where we will talk into detail about it. So to low back pain, what is it about? I mean, I know it's low back and pain, but...
Yes. You know, the back, we have the whole back.
Yes.
You know, and the back is divided into 3 areas. We have the upper back,
Okay.
the mid back, and then the lower back. So
Okay.
if you see,
Okay, so yeah, that's what is on our screen now.
Exactly.
Yeah.
you realize that we have, you can imagine and then divide it into 3.
Okay.
So from the base of your head to somewhere the okay, so we have the thoracic vertebrae.
Okay.
We have the cervical from the neck. We have the thoracic. We have the lumbar, then the sacrum.
Okay.
Okay, so from the lower head down to somewhere your shoulder blade
Okay.
should give you the upper back. And then from the shoulder blade down to a bit where you see that the spine is becoming bigger
Okay.
will be the
Middle.
and then where it is big down to the structure that is like the love,
Okay.
we will term that place low back.
Low back. Okay.
So basically low back pain is going to be the kind of pain that you experience in the area around where the spine starts becoming big till your gluteal folds. When we say gluteal folds, your buttocks.
Like where you used to sit down.
Yes.
Okay.
So any pain originating from those areas, we term it low back pain. Lower back pain. So basically that is it.
But is it very common?
Yes, it's common. Very common.
So
Very
like
common.
percentage-wise?
Percentage-wise, 70 to 80.
Oh.
70 to 80% of
Okay.
adults complain about low back
Low
pain.
back pain.
Or even experience it once in their lifetime. Mostly.
So you mentioned adults, so which means it's you see it more in adults as compared to children.
Exactly.
If I'm correct to say
So
that.
the age range is 20 to 40 and above.
Oh, okay.
Yes, because we classify them as the working group. You understand? We classify them as the working group. We can even bring it down to 18.
Oh, okay.
Or the extreme is when you have, you know, children. These days you have children being pushed into working early.
Yeah.
Forced labor. So 15 and above can start experiencing low back pain. But mainly the most documented is from 18 or 20 to 40 and then
and above.
and above, yes.
Above. Oh, okay. Okay, so you've spoken about posture and all that.
Yeah.
Are there other causes of low back pain? I know you still talk about the posture. If maybe you can go into detail.
Sure. There are several causes of low back pain, and usually you would want to we classify them. So we have that of the traumatic classification.
Okay.
This is when maybe by mistake you fall, you get involved in an accident.
Okay.
If maybe you are a footballer, a contact games that involves contacts.
Okay.
Maybe somebody hits you in the waist area and all that. So we term those ones as traumatic low back pain.
Okay.
And then we also have those that result as a result of tumor. So you may have, by some reason, a tumor developing in the back.
Okay.
It can be any part of the back,
Back.
but since we are talking of low back pain, you may have a tumor developing back there. You may also have degenerative disc problems. So in this case, you have, so it deals mainly with adults. So people from 30 and above begin to experience changes in their spine as they grow. Okay, so what happens is that when these changes go on, you realize that the disc, the spine has disc at every level.
Okay.
These discs actually absorbs shock. So let's say you jump and then you land. When you land, under normal circumstance, the bone should hit each other. But the disc is there to cushion the effect. So you are saved a bit.
Okay.
But as you age, the disc degenerates. The bones themselves also degenerate. There are several changes that occur. It could be as a result of the kind of work you do. Yes, the kind of work you do. And even posture itself, how we sit, could also result in degeneration with time.
Okay.
So when this happens, when the disc, especially the disc, when the disc starts degenerating, it can bulge out.
Okay.
Those times growing up, you have this ice water.
Yeah.
You feel it into.
They used to call it penny the penny.
Thank you, that is it. When you press it, you see it bulges out.
Right.
Exactly, that's how it happens to the disc.
Okay.
So when the disc is becoming weak with time, you realize that because of your body weight from the top, it presses on it and then bulges around it. Yes. So this can give you pain. Okay. Because it is degeneration that is causing the kind of pain. So when it happens like that, the disc can press on some other structures around the lower back. Okay. And this can give you pain. Again, too, the degeneration doesn't only affect the disc. It affects the bone too. So in this case, you have the bone at some point rubbing against each other. Causing wear and tear. Now, when that happens, since you have two bones rubbing, it will give you pain. Severe pain. And until that bone is taken off from rubbing against each other, you'll still be experiencing the pain. So that is about the degenerative causes of low back pain. We also have the inflammatory cause of low back pain. Okay. With this, this has to do with bacterial infection mostly. So there are some bacteria that could cross into the spine and then weaken the vertebral body. Now, the vertebral body is, when you observe this spine, the part that looks like the rectangular areas, those are the vertebral bodies. And it's upon it the disc sits. So this bacteria can eat into it. Wow. Yes, when you do that, they weaken the vertebral body. It can break. It can sit on each other. And this, when it starts sitting, we call something bamboo. Your spine will be like a bamboo. Yes, and it will straighten too. Now, when it's straightened, this is when posture comes in. When you observe the structures on the screen, when I observe you, so you can see normal spine. The normal spine, when I observe you frontwise, we call it the anterior view. I should see a straight structure.
Okay, so as I'm standing straight, and you are in front of me
or behind you.
Behind me, you should see a straight bone,
Yes,
kind of,
a straight
right?
arrangement
Okay.
of the bones or the spine.
Okay.
Good. If I want to observe you from your side,
Either left or right.
Yes, we call it a lateral view. I'll see an S structure.
Okay.
So from the neck, through the chest, through the lower back, to the tail area, it should be
S-shaped.
Good, S-shape. So that is what you see there as the normal spine. So you see it straight and then S.
The S.
But there are times when we have the spine coming out of the normal, because it's not part of the normal. So the normal, you see it as the kyphosis. So should I say the achacha? They are not the achacha group. Though, but they have an exaggerated curve, you see, this way. Good.
Okay.
So that is out of the normal. You get it? So when they eat up or they destroy the vertebral bodies, you realize that the spine will take different shapes. And because it is out of the normal, you start experiencing pain. And aside that, we have other causes.
Okay.
The back itself harbors a lot of things. The back into the waist harbors a lot of things. You have the kidney going down there. You have the, especially the ladies, you have the uterus down there. You have the bladder in men and women. You have so many structures in there. You understand? So problems from these structures can refer pain into your waist.
Oh, okay.
Yes. Problems from these structures can refer pain into your waist. So sometimes you may think it's the back, you are having a problem from the back, but in effect it could be an organ having a problem. The gallbladder could be having the liver itself sometimes and refer pains into the waist.
Okay, right. So I think we've learned something, but we need to go for this short break. When we come back, the discussion continues. You don't have to go anywhere. We shall be right back.
We want to defy our family's decision and get married or elope. I need advice. What should I do?
Please, what should I do?
How do I tell her I cheated on her months ago? I need help. What should I do?
Okay, so for me, the moment I read the story, the first thing that came to mind was, wow, knowledge is indeed power. Sometimes we go through situations because we have no knowledge of how to go about them.
If you come from a home like that, you are likely to accept anything the outsider would, direct us.
The fact that we had an interesting ceremony where a priest prayed and all of that doesn't mean that magically you have turned into something else.
If he finds his way to God, a Bible-believing church, and he goes and he wants to change, nothing is impossible.
Is he giving his properties to charity and stuff?
Oh no, why? Okay, I think this is another discussion that we will not end today, so we will not even go into it.
Real Talk, showing this and every Wednesday at 8 p.m.
In Exodus 25, God called Moses to the top of the mountain, and he showed him the whole business of the sanctuary.
And let them make me a sanctuary that I may dwell among them.
If it had not been for sin, the sanctuary would have been in heaven alone.
When sin came and we were separated, what God had to do was to bring man back to himself. And that is what God did through the sanctuary.
It is through the sanctuary that we have gotten what we know today is our temples, our synagogues, and all the names that you can make out of.
What in the world is happening to our churches? A sinner who is coming before God to ask for forgiveness. And you are dancing and jumping.
In the name of
praising
praising
God,
him.
praising him. When angels are prostrating, if we want to find God, we have to go through the sanctuary because he is in the sanctuary.
Join us as we bring your way with the message of the gospel in symbols, the sanctuary.
The Sanctuary Trumpet. You will not want to miss an episode.
Hello and welcome back from the break. This is Healthy Living on Hope TV, and as I've mentioned earlier, we are discussing today low back pain. We've spoken a little about it, but I don't think you've missed anything. The discussion is still ongoing. You can join us or send your comments or questions to our WhatsApp line on 0559 680066, 0559 680066. You can also join us on Facebook Live on Hope TV GH. So before we went, we spoke about the normal spine and the abnormal spine. So to continue, you mentioned the abnormal curvature. I know they call some scoliosis or kyphosis or what have you. Is it natural, like someone is born with it, or along the line, like you mentioned about trauma and all those things, can any of those result in one having an abnormal curvature of the back?
Yes. People are born with problems with the spine.
Yeah.
Someone can be born with curvatures in the spine. We all know the hunchback.
Yeah.
They were all born with it. Good. But along the line, yes, lifestyle. You know, when you're a student and you're going to school, you carry your bag on one side of your shoulder.
Yeah.
Guy.
It will be going.
Yes. So with time, as you continue like that, with time you just be this way.
Ah.
Yeah. And again, naturally, there are some people, especially when you observe hand dominance.
Okay.
People who are
right-handed,
you observe that they are a bit tilted to where they are dominant.
Hand.
Yes.
Okay.
So it also has a problem with the spine. But until it gives you pain, it's fine.
It's fine.
You can come into this world with a curved spine. If it's not giving you any problem, that is fine.
It's not affecting your daily life.
That is fine.
Okay.
If because of lifestyle you develop any lateral, if the screen can be changed, any lateral curvature in the spine and it's not giving you any problem, it is fine. But yes, people are born with it. People through lifestyle develop it. Accidents can cause lateral or curvature in the spine. Yes, so that is it.
Okay.
Several problems can result
in that.
Yeah.
Right. So let's talk about symptoms. I know someone will say it's pain. Pain is pain. But are there other things that one will experience to know that, there's severe kind of
Yes,
back?
there are several things people can experience when you're having low back pain. So the spine, as you see like that, we have the spinal cord running through it down.
Okay.
From the base of the head.
Okay.
The brain, as it is, tapers down into let's say a long rope through the spine. Okay. So as it goes through, you realize that the curvature, the curves in the spine would impinge on the nerves.
Okay.
Okay. Now, what happens is that if it's in the low back, the area, the spine innervates the lower legs. So at some point, you see there are holes coming out of the spine. Let's take the blue colors.
Okay.
We have holes coming out of that area. Through that area, we have the nerves passing through. And they give the leg sensation and then movement. Now, when you have a change, a little change in the spine, the possibility that you press on the nerve that is moving into the leg is high.
High, okay.
Now, when it is pressing on the nerve, you may have some tingling sensation. That's different from the pain you're experiencing.
Okay.
You may also have pin and needle.
Okay.
So someone can come to you and say, oh, I'm experiencing it's like some sharp pain or something cutting me. Those are some of the symptoms. Apart from pain.
Okay.
Sometimes at a very advanced stage, you have paralysis where you find it difficult moving the leg.
Oh.
Yes. So these are all nerve involvement. Apart from the spine, shifting or pressing on it, the disc, as we talked about, when it is bulging, it can also press on the nerve.
And cause pain.
Yes. Again, to the, like I said, when the bones are rubbing, they develop sores.
Okay.
It's like that. So the symptoms varies.
Yeah.
It varies. It can be tingling sensation, it can be numbness, it can be pin and needle, it can be anything that will push the person to come to you. Yes.
So I would want to ask, pain is pain, as you said, it's subjective.
Yes.
Someone will say, oh, I'm not really feeling it, so let me just observe, but maybe deep down, it may be causing something very serious. So how do you know when to seek medical attention? Because one would say, it's like headache. Today, my head, let me take para and sleep, it will go. Can we say that about low back pain? Is there like acute, just take some pain medication, we are fine? Or once you start experiencing that pain, you must seek medical attention?
Yes. So we can classify those ones two into acute, moderate, and chronic. So the acute is from a week to 6 weeks.
Okay.
And that one usually is managed by the normal medicines.
Medication.
Yes. The moderate, between the acute and then the chronic, is between 6 weeks to 12 weeks.
Okay.
Good. And then we have the chronic. The chronic is 12 weeks and beyond, 3 months,
that's 3 months
upwards. So those are the classifications. So when it is acute, it's fresh. It can be managed so easily. But from the moderate and above, you can seek medical care. But sometimes too, like we are saying, the pain can sometimes be very unbearable, even in the acute stage. So you still need to visit your physician. Or in a case where it's disabling you, so we discussed that at some point you may not be able to move. You find it difficult moving. When you are trying to stand, you stand and you have to stand for some time before you start moving. When these things start affecting your daily activities, you need to seek your doctors or the physiotherapist consult. Yes.
Okay, now we've spoken about chronic, acute, and all that. Now to posture, because everything that we are talking about boils down to our posture.
Sure.
So one will ask, I want to prevent back pain. I don't want to do this. I don't want to go through all this, whatever, nerves and all that. What is the right posture?
It's a big question. We don't have any right posture.
Really?
Yes.
But we still have low back pain. So what are we doing wrong?
So yes, so the issue is, we don't have right posture. So like we discussed that there are some people who are this way or this way. They are normal.
Yeah.
There's no pain. You get it. So with posture, everything is fine. The issue about the pain is when you are stressing the structures around the spine.
Okay.
So the spine is erect this way. You have muscles holding it in place.
Okay.
Now, if, let's say, I'm seated this way and I'm tilted this way again, the body is almost out of the normal.
Yeah.
Okay. Now, if I should stay in this position for a very long time, I'm stressing the structures here.
Okay.
And I'm stretching this one.
Yeah.
Good. So, if the body is unable to bear the stress I'm putting in here, it will react back.
Oh, okay.
You get it?
Okay.
So, the reaction back is to inform you that, hey, you are hurting me. So, it will tell you that I'm hurting. So, that is, your brain will interpret it as pain. So, then come back to the normal. You understand? So, yes, we don't have any fixed.
Lay down, be like this.
No. Yes, no.
Let your neck be straight.
Yes.
Or turn your head like this.
When you come to me, I may tell you, oh, sit straight, do this. But in the case where you are already like this, would you come this way? No. You get it? So we don't have any fixed posture.
Okay.
Even though we have this one, this is the
normal.
average. Everyone, this is what we should exhibit.
Okay.
But in the case where you are out of this one and you're not experiencing any pain, it's fine.
It's fine.
Yes.
You're not experiencing any pain, it's fine. Let's talk about treatment, because I know that this low back pain issue, it's very common, especially among people that sit a lot or stand a lot. Can it be treated or managed, let me say it like that, in the first place? Is there anything like that?
Yes, there is.
There is?
Yes.
Effective or?
Yes, it's effective. Yes.
Okay,
it can be treated, it can be managed.
It can be managed.
Yes.
So let's talk about management, then treatment.
Okay.
Or maybe if it's the same.
Yeah, it's almost the same.
Okay.
So we have the invasive, the conservative.
Okay.
And then that of the NSAID. Okay. So I'll start from the conservative. Conservative basically is about things you do to help the back. So when we talk about the conservative, that is where you come to physio. That's when maybe some may opt to go to the chiro and all other things. I'm a physio, so I'm talking for physios.
Okay.
Yes. So we try to give you exercises. We try to give you heat therapy, rest, cold therapy, hydrotherapy, therapies that will reduce the pain for you.
Okay.
Therapies that can also make the pain go.
Oh,
yes.
Okay.
It's effective. You get it? So some patients may come and it's all about management. Some patients may come and you may treat them and they'll be well.
They'll be well.
Yes. So that's about the conservative. Then we have the invasive. This usually is the advanced stages. For a patient who finds it so difficult to move, there is paralysis.
Okay.
And it has been identified that maybe the nerves are compromised. The bone is pressing on the nerves, or the disc is pressing on the nerves. Then the invasive will come in, where they would have to go and cut and then try to separate or the compression. They will decompress the structures on the nerve, so that at least you may have your sensations back.
Okay.
You have your strength to move back again. So basically that is the invasive one. Or if in case there is a curvature and they have to correct it, they will try and do all those ones. And the NSAID basically is medication to deal with inflammation, the pain as well. Good. So basically that is it. So we have the invasive, we have the NSAIDs, we have the conservative treatments too. So usually they go hand in hand.
Okay.
If per you go for the conservative one, sorry, the invasive one. You need to come for conservative treatments. That is the physio, to bring you back to life. You get it? And even usually before you go for the invasive one, you still have to be doing the conservative one, which is physio, to strengthen the muscles, because when they go and then they do some cutting, you'll be immobilized in bed for some time.
Yeah.
The strengthening over the period before you went for the invasive treatment or the surgery would help you within the period when you are immobilized. Before you start the physio again.
Oh, okay.
And then again, the conservative, which is the physio, also goes hand in hand with the anti-inflammatory or the analgesics going to be given to you. So whilst you are taking your pain, your analgesics, your painkillers, you still have to be doing your physio. You still have to be doing your exercises. You still have to be coming for the heat therapy to be done, the electrotherapy to be done. Those ones are other things we will want to discuss at another time. Yes, but those are the treatments the physiotherapy will do to you, for you.
Okay, to prevent the pain or to gain your strength back. Okay, so let's go for this quick break. We'll return shortly. Don't go anywhere.
Once again, you're welcome to the program Take a Break.
If it is God you want to follow, you must follow the Bible. Okay. If it is men you want to follow, then you can follow your pastor or your church, but I guarantee you, they have no heaven to put you in.
If we trust in God, when we know that God will help us in every situation that we find ourselves, then we bring God in the boat.
Take a break, showing this and every Friday at 6 p.m.
Asetena ye twemu hyen. Obran mu nsem dɔso. Emu akukura hwe ase dɔso. Abenidie ene ohaw. Anigye ketua bi ne hom. In the Hope Channel, the abrabo yi mu nsem the brew. The nu mu na. Akukudam ene wona wa ben wa de suam efa abusua ho nsem ene bran mu nsem betwetwe nkomo.
Yankopon pesa warefo nya nigye. Nti de edi kan hia pa yese. Ubehwe onipa opeso wa na ohwe ekuo bi a woni omu nyina esom ese nipa a woni won egidie ye baako ebi a woni nyina som eko baako saafo no mu na sese obehwe eyira na ekunu
enti famre na ne yenhia wa asetena yi mu nsem so na beboa wo amonya nigye wo bra mu ebeboa wo ama otipa yi nyina ate ahwe efise Kristo wo fi odomo a enigye ehyefi homa ene yentena na abra enko sedia ozihwe medas
Matthew, say Mark
say Luke.
Look at Matthew.
Matthew say everybody.
I have a school father who smokes weed. Is it right to still hang out with him or stay away from him?
I'll report him, but let me tell you the reason why I'll report him. Because this one, if he gets into trouble, because I was working with him, I'll also be in trouble.
Isn't that selfish?
I don't care. Hey. Like if I'll also not be in trouble, like me, I'll not mind you.
Oh. So what's your rationale not for reporting them? Why won't you report them?
Everyone deserves a second chance.
Saw this picture that a mother posted on top of her fridge. You are not hungry, you are bored.
So you eat out of boredom?
A little. Okay, wait, let me be truthful. A lot.
I don't think having a boyfriend is a bad thing.
Okay.
It's just like, let me say, Ghanaian mentality.
Hey.
Because when you say boyfriend, then something else pops up.
And you are welcome to Teens Connect, the platform for teenagers where we can express freely our thoughts and opinions on various subjects that disturb us, subjects that worry us, and subjects that cause us to think. On this platform, we say anything and everything as long as it's bothering you, and we try and find solutions for ourselves.
Hello, welcome back from the break. We are discussing lower back pain, and if you just joined us, you can still learn something before we close. My guest for today is Mr. Michael Bakwaya, who is a physiotherapist, and so far he has taught us a lot. But before we close, we still have more questions for him, and you can also send yours in to our WhatsApp line on 0559 680066 or join us on Facebook Live on Hope TV GH. Before we left for the break, we were speaking about prevention or management. Sorry, treatment or management, yes. So let's talk about prevention. How can we prevent low back pain or lower back pain?
The prevention is doing things that will not stress the body.
Like what?
So don't sit for a long period.
Okay.
When you have low back pain, it compromises your capacity to sit for a very long time. It compromises your capacity to even walk for a very long time or stand for a very long time.
Okay.
Yes. So don't do things that will hurt you.
So
for corporate workers who sit for a very long time, once in a while, whilst you are seated, intermittently walk around, intermittently stretch your body, and then come back. Give the body that rest period. When you sit for a very long time, you stress the lower back.
Lower back.
You get it? So it's always important, prudent that you give the body a rest period. Go and stretch, try and lie down if you have the luxury of time. Then you come back and continue the work.
So say if you sit for an hour, you go for say 5 minutes break, or if you sit for 30 minutes, can you break that down for us?
Yes, you can do that. So if you sit for say an hour, you can go for 5 minutes stretch or walk. Even 30 minutes, you can still, if you have the luxury of time, you can still give yourself 5 to 10 minutes. That is if you have the luxury of time. You get it. And one other thing is that for those of us who do the menial jobs, the very strenuous activities. There are certain body postures we should assume. So if you are trying to carry something that is a bit heavy. You don't carry it bending this way. You carry bending your knees.
Okay.
So you carry it from the ground this way. You don't go this way.
So that I don't put pressure.
Yes. Today you may not have the pain, but a consistent or the frequency will give you the pain. So if we desist from or reduce the load, we reduce the load we carry every day, even on our head. All those things will be a preventive way of
avoiding lower back pain. Okay, we have questions from our viewers. The first one says, how do you tell if lower back pain is with the muscle or the disc?
Okay. So with the disc, like I said earlier on, sometimes it can be bulging. Now, if it bulges forward, so with the inscription we see, the drawing, if it bulges forward and you are asked to bend, you will impinge on it. It may give you pain. That should give you an idea that maybe the protrusion is towards the anterior area.
Front.
If it is to the back and you're asked to extend
to your back,
yes, you may experience the pain also. Then it should tell you that there is a disc protrusion somewhere. Now, when it is muscle, usually for muscle, the pain is localized. Or you may see that the muscle that is reacting, it will go into spasm. So that the area becomes a bit hardened. So those things will give you the idea that, it's a muscle involvement or it's a nerve involvement. But those ones are not to be determined by you. It's your physiotherapist who determines
or your
that.
doctor.
Yes.
Okay. Right. The next question says, how does a slipped disc feel like in the lower back?
Wow. Feel like in the lower back.
Like, will you feel the disc like pushing somewhere or anything?
Yes. If it's the disc is impinging on the nerve, we may think that way, but usually it's the diagnostic period. That's what we'll get to know. Sometimes people will come and say, I was lifting something, I heard pop. That sound, it's two things. It may be a broken bone or the disc that has bulged. So until you go for an X-ray or an MRI to tell you what is actually happening to the disc, you can't tell.
Okay.
The X-ray will only give you the bone arrangements, but the MRI will go a bit into details to give you where the disc is. Is the disc actually bulging or all that? You get it? So you may not feel the bulge or the disc, but sometimes the presentation, if it is pressing on a nerve, maybe you may think that way, but it's always during the diagnostic period when we are using the MRI or the X-ray. That's when you can
detect it. So there's another question that says, how is one supposed to sleep when the person has lower back pain?
Okay. I wish I had bed to demonstrate.
But you can still show us something.
Yes. One thing is your bed should be very good. It shouldn't be those ones that will sink in when you sleep. Maybe on your back, you have your back sinking in and then yes.
Okay, like the mattress.
Yes.
Okay.
It should be good enough. The pressure should be very good such that you won't sink in.
Okay.
That is one. And if you have back pain, there are ways you need to sleep. There are ways you can sleep with a pillow.
Okay.
So you have your pillow. When you're going to sleep on your back, you can put the pillow beneath your knee. So in a technical term, people will say put it at the popliteal fossa, the area, that area. So when you put it there, you realize that your back will be flat on the bed.
Yeah.
When you do that, you take a lot of pressure off the back. You get it.
In that way, will you be using a pillow like behind your head?
Yes, you can. You can choose to use a pillow behind your head. You may not choose to, because when you are sleeping on your head this way, everything is in the neutral position.
Okay.
You get it. So if you put the pillow down beneath your knee, you take a lot of pressure
from your back.
If you want to lie on your back, the best thing is to put the pillow in between your thigh.
Okay.
So you put it on it this way. It also takes pressure.
You mean lie on your side?
Yes, on your side. You put the pillow in between. Now, you may, for someone like me, I may do it once and I'll get the position very well. But for you or someone who is trying to, you may have to adjust several times just to get the good position for yourself. You get it? So that is it. If you have low back pain, there are ways you can sleep with your pillow. There are ways you can sleep such that you don't have so much pain.
Okay. And then the other says that is walking good for a bulging disc? I say your disc is bulging. Is it okay to walk around, or something will just explode inside you and you are gone?
I don't know if this person is experiencing a bulging disc and wants to still walk with it.
Okay.
Well, we can't stop you from walking. You need to walk.
Okay.
Okay. So if the disc is bulging, I think your physician or the physiotherapist would have to tell you it is bulging. You get it? Now, if your walk disturbs, assuming we've seen that you have a bulging disc and the walking disturbs it, then it means that the pain probably may be going into your legs. Then there has to be a decompression. Or physiotherapy has a way of, we have this traction machine.
Okay.
So it helps track you tract you for the disc to fill in back. You get it?
Okay.
Or whilst the exercise goes on, we are trying to strengthen the back muscles. Sometimes when the back muscles are weak, they leave their bones to sit on each other. But when they are strong, they try to open up a bit.
Okay.
Because they are holding it now in place.
Mm.
You get it? So some of the exercises aims at trying to tract or decompress it. If that is not helping, then we may go further for surgery and see if we can decompress it even further. So yes, you can walk, unless it is disabling your the walk. Yes.
Okay. Another person wants to know, what is the best treatment for lumbar spondylosis?
Okay. We actually don't have any best treatment. When you have lumbar spondylosis and you've been identified that you have lumbar spondylosis, per the assessment your physiotherapist has done, he will do his treatments towards your the condition. You get it? So you may come to me, I may use certain devices for you. You may go to a different physiotherapist. He may also use different devices for you. What we are all aiming at is for your
recovery.
Yes. So we don't have one best treatment, but in all you see some of the treatments flowing through. Mostly, especially some of the exercises, you see some of them flowing through, but for the other ones it may differ, because maybe you may come and probably you've had a surgery somewhere before, and maybe there's a metallic implant somewhere. I may not do it for you. You get it? So we don't have any best treatment
like
protocol.
laid down.
Yes.
Something. All right, Mr. Vakwai, I think the discussion has been interesting, but our time is fast spent and we will need to end here. So I will take your last words. What advice do you have for us concerning our back, how to protect our back, and how to prevent lower back pain?
Okay, my advice to everyone is that we just have to keep in mind that the spine is a lifeline to the body. If you have a problem with it, it reduces your quality of life. So as much as possible, we should do activities that will not put too much pressure on it. By doing that, we'll be fine.
By doing that, we will be fine. All too soon, we have to end our discussion, but I know that you've learned something today, if not at all, how to prevent lower back pain. But we'll have to end here. Thank you so much for making time to watch, and make a date with us same time next week from 8 p.m. to 9 p.m. on Hope TV. My name is Bibi. Thank you for watching. Take care and good night.